I'm Jim Sayre, and we live in Findlay, Ohio. My wife and I served with the Salvation Army for over 40 years in Western Pennsylvania and in Ohio. I've got two hobbies. One is doing some woodworking occasionally, and the other one is playing the cornet. I had been practicing my cornet, and I believe I passed out, slumped over. I kind of vaguely remember hitting my head on the table. I was on the floor, and the chair that I had been sitting on was sideways on the floor, and I was trying to get up and just couldn't seem to figure out how to get my legs under me. Our daughter, who lives less than a mile from here, and she came right over and took me down to Blanchard Valley Hospital.
During my initial evaluation of Mr. Sayre, I did a neurological evaluation and got some more detailed history from him. And he was having some subtle findings of a stroke that was involving the posterior circulation of the brain, the balance centers. And so those can be somewhat subtle. And so after my evaluation, he went for a CAT scan, and I reached out to the neurology department at Ohio State for some further expert guidance. The Telestroke program here, we utilize what we call robot, which is really just a screen that has a camera on it that the neurologist will look at the patient, and they have a nurse or sometimes a provider, in the case of this patient, in the room during the examination. Well, they'll have the patients go through their neuro testing, ask questions of the patient, ask questions of the family, ask questions of the provider as well. And all this happens real time, so they're able to see the patient and evaluate them and then give instant feedback and recommendations based on their exam.
So after evaluating Mr. Sayre on the robot, we recognized that we were dealing with a stroke, and he was eligible for one of the medication which we gave called TPA, or the clot-busting medicine, and we decided to provide that medication right then. And then, as we know, the time is brain. Every minute you lose millions of neurons, millions of brain cells, and given this thought process, Mr. Sayre was transferred right away in a helicopter to Ohio State University.
At first I was wondering why Ohio State and why transfer me. It was very briefly explained that if I had complications from the stroke and further damage, that there were specialists that could deal with whatever went wrong. We landed at OSU, the helicopter door opened, and we went right from the helicopter platform to the elevator, straight down to the CAT scan.
Once he got here, we performed the CT scan of his brain, and we looked at the blood vessels, and we decided that Mr. Sayre needs some stroke workup, which we performed in a day, and then Mr. Sayre was discharged back to home, just because of the fact that he was doing better as compared to when he presented.
I am doing very well. I tire a little more easily than I would have before. Nobody would know I'd had a stroke if I hadn't told them. I thought Ohio State was just very thorough and very professional and very kind, and I was very, very pleased with the experience.